Lung cancer screening is very important. It has been shown to reduce deaths due to lung cancer by 20%. And a lot of times we need a biopsy to figure out if it is lung cancer or if it's something benign.
If there are lesions that are smaller or more difficult to access, such as those in the upper lobes, there's the robotic system that's available. The Monarch platform is a state-of-the-art bronchoscopy platform that we can use robotic technology to help us navigate to peripheral lung lesions to sample them and diagnose and hopefully treat patients.
It allows for much superior control of the tip of the scope in the periphery of the lung. And not only that, it's very small, adding to the precision, but also we have vision in the periphery of the lung in the segmental airways like we've never had before.
All previous bronchoscopy systems have involved one of the providers actually physically holding the bronchoscope during the entire procedure. And so you can imagine with longer procedures that can be difficult to stabilize the scope. You have to make sure nobody moves because that can really impact the biopsy. With this robotic system, we're not holding the scope. The robot is holding the scope. We are manipulating the scope, and that's an important fact, is that the robot does not operate independently of any physicians, but it makes things more stable. We can get out to further generations of lung airways and sample lesions that would have been more difficult with the previous technology.
We're not only able to get a more accurate diagnosis for these lung nodules, but we can also sample the lymph nodes, in the center of the lung, all in one procedure, so as to give them a staging and a more accurate diagnosis with this technology.
They're doing studies now using the robotic system to be able to diagnose and then treat in the same procedure. So they have technologies including microwave ablation. They can do dye marking if patients are candidates for surgery, or place little wires that can help the surgeon identify the nodule. And then they're also looking into intratumoral injection of chemotherapy. So that's really the future of interventional pulmonology, and that's why I wanted to get into it, to be able to tell a patient, we've diagnosed you with this cancer, we've taken care of it, and we'll continue to take care of you.
The Monarch platform is definitely a huge game changer, and I'm so glad to be a part of Rochester Regional Health that allows us to incorporate such an advanced technology for lung cancer.